So you've been referred to a genetics doctor. Why is it worth going? You're about to meet 3 families who asked that very same question.
Hi, I'm Ava. I'm 3 years old.
We weren't expecting any complications. We were kind of going into it ready for this picture-perfect storybook delivery. And
shortly after her birth, she suffered a respiratory issue that required intervention by the pediatrician that was at the hospital.
So we didn't know what was wrong. Later that evening, we found out that she had multiple heart defects.
This is difficult for us to talk about, especially Alice. She doesn't like to discuss it. It was absolute quiet in the OR as Leo came out. He didn't make any noise. None of the staff said anything. And Alice said, "What's wrong? Why isn't my baby crying?"
Little Leo wasn't getting air through his mouth, and a doctor had to intubate him. The next day, a geneticist diagnosed him with Treacher-Collins syndrome. When Yamila was born 17 years ago in Peru, the doctor said she had an enlarged heart, possibly Pompe syndrome, and there was nothing they could do.
It was terrible, of course, for all parents, knowing that your kid has a disease that has no cure. So there are no hope, and the doctor says that you need to go home and wait. But as a parent, I said that we need to try. We need to try and look for some cures.
And what he found was a clinical trial and a whole team of doctors.
It's like a small family and a team that's born to help not only the patient, but also the family.
A geneticist is a doctor who sees kids and adults with rare and/or complicated medical conditions.
Some families see medical geneticists right at birth. Maybe there's an abnormality or a concern about the newborn screen, which screens for certain metabolic and other conditions. Other families have children that seem to be developing fine, and then something might go wrong where they realize that their child has autism, or a child develops seizures or other medical problems, and they're looking for answers later.
And sometimes the family notices delays in their child's development. That's another good reason to see a geneticist.
In general, it involves a physical exam. That's what happens when you go to see most providers, reviewing the history, updating it. We spend more time on the family history because any testing we may consider is done within that context.
One of the things that we can do now that we couldn't do even a couple of years ago is that we can do a lot of things by cheek swab. So people who are afraid of needles now have another option where they just rub a Q-tip around the inside of their mouth, and we can get their genetic information that way. Some things that we look for the amount of DNA that they have. If they have any extra or missing DNA, we can look for spelling changes in DNA that might cause a syndrome that would explain a person's medical concerns.
And then you have the genetic counselor who's able to really translate, I always think, kind of translate that information in a way that the family can understand.
In most cases, having an answer, a name for a child's medical condition is really important. For example, when patients have an answer, that means that they can reach out to families across the world who may have children with the same exact rare condition.
Go to one of the Facebook groups, the parent support groups versus Google, because that's where you get the real information.
We went to the Treacher-Collins syndrome Facebook page. If you ask a question, they will respond with 75% what a cute little kid, and 25% okay, this is what you need to know. This is what our experience was. And so kind of practical troubleshooting, which was amazing and very, very valuable.
Not all families realize the value of a genetics appointment, the benefit of a possible diagnosis, the connections with other families, and they don't keep their genetics appointment.
People may think that, oh, well, I can't change my genes right now. Why bother go to see genetics? Some people have a hard time getting to us. Either they don't have transportation. I have some families who don't like driving in the city, and so they won't come see me because they would have to drive in the city. For families like that, we offer telemedicine, and that can be a great way to get at least a first visit done. And we can assess whether or not we need to do a second visit, to do an in-person visit.
So if a parent is on the fence about coming to genetics, I would absolutely advocate for them to at least go to the visit and share this information about their child, because I think that genetics professionals really have a unique perspective. We take all of these little pieces and we try to say, is there one underlying explanation for all of this?
El mejor consejo que le daría a un padre que vaya a visitar a un médico, a un genetista, y si hay que buscar muchos para tener opiniones diferentes, lo haría una y mil veces.
It's intimidating to know that you might come out of meeting with a geneticist with a diagnosis that you certainly never hoped for your child. But I think knowledge is power, and you only have that knowledge if you go through the process that could be painful, but at the end of the day arms you with the knowledge to do what's best for your child.